Have you guys been having a lot of classes?
Yeah, not so. We've had, oh my God. I mean, the October and November were just crazy with events and festivals
Mm-hmm.
and health center. I mean, end of year, Medicare, all these different things we've been trying to do. And then just like 6 days a week, crazy. And then recently we had, all the early Pride and then World AIDS Day and other things there. We worked on.
Sounds like a
Right.
busy season.
It has been a busy season. It's only going to get busier. All
So
right,
I
Lex.
don't see anyone
I
in
know.
yet.
Nope. That's all right. I just sent another reminder to the people we had on ours with the Zoom.
Yeah, I saw that.
Yeah, but yeah, I went ahead and added you the other day. I
Yes,
I, I
thank you.
usually try to, and I forgot that add you and Beck. But
No, that was really cool. I saw that also earlier this week
yeah,
come through, I think. Yeah.
yeah. In the worst case, I mean, I mean, if somebody joins or doesn't join, I mean, it's always one of those things. This hour, we're trying to gauge it. And
Mhm.
plus, you have your food bank thing
Yeah,
tonight.
which
So some, I
wasn't
know,
scheduled when we scheduled this originally, and it
no,
was
I know.
I put
That's,
that back on Charles, but
I
that'll
know.
be
Say
something that
Charles. Yeah.
I'll think about for next time. Um,
Yeah, but I was just talking with Willie while we're talking, and what we're going to do is we'll do the presentation anyway, regardless of who's on, and we'll
Yeah.
record it so that way we can get it out and put it out.
Yeah, and then we can send it out
Yeah,
to the
yeah,
folks that signed up
yeah, yeah.
because it's coming onto our Zoom account, so we
Correct.
can download it and then upload it into our YouTube page.
Yeah, and then what I'll do as well, I mean, I edit it on my side. So you'll get it, you'll get the recording, Bex or someone will send it to me. I'll edit it on our side with our logos and different things at the front and back,
Mhm.
and then get it back to you with the YouTube and other ones. There's somebody.
Cool.
Andrew. Yeah. Yeah, and then we can talk about in person because Willie was talking about maybe March or April doing in person and on that the group on Friday, not sure completely if what that is, but there may
Yeah,
be others that we could other support groups or during the week or late afternoons. I don't know.
yeah,
Or it could be appropriate for Willie and his expertise or others.
yeah. Well, just want to say welcome. If you just popped in, we were just chatting about other future Eisenhower Health Lectures. My name is Lex Ortega. I'm the Chief Programs Officer here at the LGBTQ Community Center of the Desert. That sultry voice that you heard before me popping on was my colleague and very good friend, Brett Klein with Eisenhower Health. I'll just say a few words about the center's longstanding partnership with Eisenhower. They are our preferred health partner here in the desert, and we are very grateful for them to share their expertise and their knowledge with our community. Last month, we had a workshop on vocal congruence for trans and gender expansive folks. Next month, we'll be hosting a panel on palliative care, end of life care. And today, we're very excited for today's presentation, but I will pass it to Brett to share housekeeping and any other
Yeah,
details.
perfect. I think you can all hear me. If you hear reverb, it's because Willie and I are both in the same room, so we have mics that are very close to each other. But so yes, welcome everyone, and thanks Lex for the intro. And then yeah, some of the housekeeping pieces. So this is being recorded. As people join, we'll add in. But the good part about this is we're recorded, then we will edit it and we'll get it to the Eisenhower Health YouTube channel as well as the center's YouTube channel. And then we will also email it out to everyone who registered so that you'll have it as the link as well. And that'll probably be done given the holiday next week. It may be a couple weeks before it's out, but it will be out to you. And then all of our previous lectures and all those other things are on both sites to be able to access on the YouTube channels. But I'm excited to introduce Willie because, and Willie will tell you more about his experience and his background. But I have just had a pleasure of working with Willie the last couple of years. I think at this point with really intuitive and when I say PT because it's hands-on, but it literally is hands-on. Um, his mindset, how he approaches it, the complete fluidity of everything we talk about for all different individuals And I can't say enough about Willie and his team. And we'll also be talking, well, we were talking if you joined in early, we'll be doing something in person. We're going to be thinking through that about what that might look like at the center. So Willie can come out and actually meet people face to face. So with that in mind, as I said, it is being recorded, and we'll keep everybody at this point muted, but as we get, we'll answer Q&A at the end, and then if you have questions you want to put in the chat, feel free to do so as well. So with that, I'm going to turn it over to Willie, and we'll get started. Willie, it's all yours.
All right, thank you for the lovely introductions. My name is Willy. I'm a pelvic health physical therapist at Eisenhower. Today, I want to discuss sexual dysfunctions, including pain with intercourse. Okay. There. So a little bit about me. I have my doctorate in physical therapy, and I do have a lot of passion about bringing pelvic health to the queer community. So what is pelvic floor therapy? It's a specialized form of PT that focuses on the rehabilitation of the muscles, ligaments, and connective tissues of the pelvic floor. And our goals are to restore function, improve anything related to bladder, bowel, and sexual functioning. Also, we want to reduce any pain that you might have in the pelvis, including the back, hips, and groin. And we also want to enhance your quality of life, improve daily activities, reduce anxiety, and increase overall well-being. Okay. What are some common myths and misconceptions that about pelvic floor therapy? A lot of people think it's just for cis women, which it isn't. It's for everybody. Kegels are not the only thing that we do and are not the only solution for pelvic floor issues. Pelvic pain is not normal. A lot of people think or they live with pelvic pain, and it's something that's totally treatable. Another myth is it's only for postpartum recovery. Again, it's for anybody. Seeking help is embarrassing or unnecessary. You know, it might seem uncomfortable to talk about or think about, but we see these conditions every day, and again, they're very treatable, and it's just like treating any other part of your body. And the treatment is invasive and painful. No, we're very gentle with our approach, and we meet you where you're at. And we can treat things externally if the internal work is a little too intrusive. So overall, it's a wonderful therapy and option for folks that a lot of people don't think about. So here's some anatomy for assigned male at birth or penis owners. And you can see the pelvic floor muscles in this angle, and then I'll show you some of the muscles here. You can see the muscles of the pelvic floor, under the bladder, and rectum, so supporting, lifting those organs. And here we have some anatomy depicting the pelvic floor of assigned female at birth or vagina owners. So back to the functioning of the pelvic floor. Again, the pelvic floor muscles form a little sling, and that holds up some of the pelvic organs. It controls urination, bowel movements, and sexual function. And it also helps stabilize the core, working as a part of a functional unit with your abdominals, your diaphragm, and your back muscles. Okay, what do we treat? We treat a whole bunch of things. So urinary frequency, hesitancy or retention. We can treat constipation, hemorrhoids, anal fissures, incontinence, urinary and fecal, nocturia, which is nighttime urination, excessive nighttime urination, um, vaginal or front hole prolapse, rectal or back hole prolapse, and pelvic pain, sexual or just in general, as well as erectile and ejaculatory dysfunctions. We also treat a lot of pre and post pelvic surgeries, including prostatectomies, hysterectomies, gender affirmation surgeries, pre and post partum, as well as pre and post pelvic cancer treatments, including anal, rectal, ovarian, cervical, and prostate cancers. So we work with a lot of other healthcare specialties, urologists, gynecologists, gastroenterologists, oncologists, psychologists, and sex therapists, for a few examples. And we try to, sometimes it takes a village, and we want to have a good team on the same page to address some of these pelvic floor dysfunctions. So it kind of gives it a more holistic approach to your care. In terms of treatment, we employ a lot of things, including biofeedback training, and you can see an image here on the left of our biofeedback machine, where we place surface electrodes, kind of like an EKG, around the muscles, the skin of the perineum, and that helps read your muscle activity. So you can see when your muscles contract, you'll see a graph, that graph rise, and when you relax, you should see the graph relax. So that's a helpful tool for patients. We also do manual therapy, which could include internal treatment like stretching of the soft tissue, or externally as well. We also often use strengthening, so a strengthening program, and or relaxation program, depending on your needs. And we do use a lot of education because not a lot of people know about what the pelvic floor is to begin with, so we kind of have to fill them in. So pelvic pain, that's kind of a broad term. Um, it could be any kind of pain in the pelvic region, and this includes the penis or external genitalia. Usually it's at the tip, external gonads, um, uh, the vagina, internal genitals, coccyx, the anus or the back hole, inner thighs. And so anything within the muscles, nerves, or skeleton, the bones and ligaments of the pelvic floor could lead to pelvic pain. Okay. Now, common sexual dysfunctions linked to pelvic floor issues includes dyspareunia, which is pain in the vaginal canal or front hole with penetration, and causes could be muscular tension, hormonal contributions, injury, or psychological impacts. Anodyspareunia is pain with anal or back hole penetration, and similarly, it could be caused by muscular tightness, anxiety, or past trauma. Erectile dysfunction is another main sexual dysfunction that we see a lot of, and it could be caused from inadequate blood flow, nerve contributions, hormonal imbalances, psychological and muscular factors. Now, in terms of pain during intimacy for trans folks, there is a high rate of pelvic pain found, especially with pain, you know, during and after sexual activity. So this can often be due to the surgeries themselves, hormonal therapy, or other medical interventions. And some statistics here show that up to 70% of transgender individuals they have some form of sexual dysfunction or discomfort. So some signs of this discomfort with the pain or discomfort with sexual activity include abdominal or intimate area pain, often aching or burning, pain with intimacy or after intimacy with yourself or others, inability to achieve penetrative intimacy, and difficulty with orgasm or delayed orgasm, also premature. So this 2023 study on pelvic pain after starting testosterone therapy showed that 72% of participants had pain after starting. 90% experienced pain sometimes, while 10% felt that it was always present or almost always present. 60% had pain with orgasm, sometimes or always. 66% reported pain during penetrative sex. 36% experienced pain when touching the external genitalia. And so this obviously impacts sexual activity, where 11% said that pelvic pain that was always or almost always present stopped sexual activity. So it kind of prevents the intimacy from happening. Other sexual dysfunctions that we'll cover is premature ejaculation, where ejaculation occurs sooner than expected or wanted. And sometimes it's influenced by the pelvic floor muscle tension if it's overactive or some form of incoordination. There's also retrograde ejaculation, where the semen enters the bladder instead of exiting. Again, sometimes linked to pelvic floor muscle dysfunction. But the major one we'll talk about today is erectile dysfunction. And so, again, many factors can lead to this. You have to consider the psychology, hormonal balance, and emotions, as well as the nerves, muscular strength and coordination, and your cardiovascular system, like the blood vessels. And also post-surgery, like after a prostatectomy, erectile dysfunction is common. So a little bit more about ED. How does the pelvic floor impact erectile dysfunction? So the muscles manage blood flow to the genitals by compressing the external genital veins, thereby trapping blood in the external genitals, creating an erection. So if the pelvic floor is weak, the outflow of blood isn't prevented and an erection can't be maintained. So people are losing the ability to maintain an erection during intercourse. And a pelvic floor that's also too tight can cause dysfunction due to compression of the artery that feeds blood to the erectile tissues. In terms of dyspareunia or painful vaginal or front hole penetration, studies from 2023 show that electrotherapy and pelvic floor muscle training work well together to reduce pain and improve comfort for those with dyspareunia. And so some helpful approaches they used in this study were building the pelvic floor strength to support the overall pelvic area, using TENS or the electric stimulation for pain management, using relaxation and down training techniques to lower muscle tension. And so this multimodal care approach helps bring together exercises, manual techniques, and electric therapy, and they recommend that for the best results. For erectile dysfunction or ED, a study in 2021 suggests that pelvic floor muscle strength through physical therapy or biofeedback can be helpful in improving erectile function. And so the results showed that pelvic floor muscle strength was not associated with age, but patients with severe or moderate erectile dysfunction had lower pelvic floor muscle strength. For premature ejaculation, a study in 2024 found that there were significant improvements in ejaculatory time. And through one of their tools, the premature ejaculation diagnostic tool, showed improvement after 12 weeks. Also, at the 5-year follow-up, 66% of participants maintained good results. So, pelvic floor muscle training had long-lasting effects. Another review, systematic review in 2019, showed that pelvic floor muscle training appeared to be effective in treating both erectile dysfunction and premature ejaculation. So, also, these studies recommended a multifaceted approach to care, so education, manual therapy, and exercises. Anodyspareunia, or pain with anal or back hole penetration, and physical therapy. So, a review in 2024 revealed that anal intercourse is becoming more common, but there are some risks, including the pain, as well as increased rates of fecal incontinence. And so this could be due to pelvic floor overactivity, lack of lubrication, and emotional discomfort. Pelvic floor therapy also appears to offer effective prevention and treatment options through use of education, muscle training, biofeedback, manual therapy, and the use of dilators. So we'll talk a little bit more about receptive anal intercourse and how to enjoy it pain-free. So 24 to 61% of gay or bisexual men report having painful receptive intercourse. And while the nerve endings in the anus may provide pleasurable feelings, an orgasm might be achieved through receptive anal penetration by indirect stimulation of the prostate. So we'll start with healthy bowels in order to have healthy anal sex. So you want to make sure you're drinking enough water per day. Generally, you want to drink half of your body weight in ounces of water or ounces of fluid, most of which should be water. You want a good mix of soluble and insoluble fiber. You want to add that slowly to your diet so your bowels don't get too irritated. Generally, you want 14 grams of fiber per 1,000 calories consumed. So in a usual 2,000 calorie diet, you want 28 grams of fiber a day. And you can Google fiber foods, insoluble or soluble, to see what you might like to include in your diet. Healthy bowel voiding. So besides the fiber and water, you want 150 minutes of moderate exercise per week. You want to coordinate your muscles and breathing on the toilet. So you can moo to poo, like literally moo as you're pooing, and that can help those muscles relax and get out of the way so you can void more easily. Use of a squatty potty or footstool can help facilitate more effective voiding. You don't want to strain or hold your breath or push. Don't camp out on the toilet either for more than 10 minutes, so avoid distracting yourself with magazines or your cell phone. Also, it's recommended to use a bidet for cleansing. Sometimes over wiping can cause irritation to the area, so bidets are just more of a thorough and gentle cleanse. So in terms of the anal rectal angle, when you're squatting with the squatty potty is, or a deeper squat position when you're having a bowel movement, you can see on the image on the right that the angle straightens out a little bit as you squat deeper. So stool can pass more easily with gravity and you don't have to strain as much. So use of the squatty potty or getting into this deep squat position can be helpful. All right, what's a normal frequency of bowel movements? It's anywhere from 1 time a day um, up to, 3 times a week. So you're a little more on the constipated side if you have less than 3 bowel movements a week. Usually, if you're having more than 3 bowel movements a day, that's associated with diarrhea. Um, and you can see this chart here depicting the ideal stool type. So you want to be within type 3 to 5, where you have well-formed stools. A lot of people don't know that we can help treat functional constipation. So, a systematic review in 2022 showed a strong level of evidence suggesting physical therapists should offer biofeedback to their patients, um, as well as moderate evidence supporting the use of manual therapy to help facilitate healthy bowel movements. So, for constipation, we want to focus on dietary considerations, avoiding the pushing or straining, and dysenergic defecation or dysfunction is when your muscles are contracting instead of relaxing when you're trying to have a bowel movement, which would make it very difficult to pass. So that's something we have to work with the pelvic floor muscles to coordinate and work the way they should. A rectal prolapse is when the rectum kind of comes outside of itself, and that can lead to incomplete emptying because there's like something in the way when you're trying to pass. So that's something we also want to treat and avoid constipation so that things flow a little bit better. In terms of chronic anal fissures, a study in 2022 showed that pelvic floor therapy can be effective, um, and it improves muscle tone and function, promotes healing, and reduces pain. So that supports the use of pelvic floor therapy alongside regular care. Lifestyle factors. So you want to get regular exercise to help promote healthy bowel movements. Motion is lotion, so that's going to help promote motility the more you move and get around. You want to practice the good bathroom habits that we discussed and manage stress. So, stress can impact your bowel movements. You want to practice stress reducing activities like meditation, yoga, or deep breathing. You can use, again, moist wipes or a bidet for better cleaning. That deep squat position or the malasana position depicted in the picture here can help produce a more thorough, effective bowel movement. Um, and yeah, consider getting a squatty potty. In terms of bottoming and preparing for anal sex, um, it involves both physical and mental preparation. It's important to try to have the rectum be empty before engaging, and this can be done through bowel movements or like having a complete bowel movement before or using an enema. So in terms of pelvic tools, we have a lot that we recommend, but for pelvic pain, usually it's a dilator, and that can be used to stretch the pelvic floor muscles. There are vaginal or front hole and rectal or back hole dilators, as you can see at the bottom here. And there are also pelvic wands that you can use. So this can be helpful for reducing pelvic pain and discomfort while improving sexual function. So there are a lot of stretches you can do externally as well. So hip stretches can help promote relaxation and down training of the nearby pelvic floor muscles. A lot of the yoga poses like child's pose, happy baby, are really good. And always, we incorporate deep breathing using the diaphragm because it works together with the pelvic floor. Effective communication as well is critical. You want to discuss expectations and boundaries with your partner. You can use a safe word to indicate discomfort or pain. Lubricant use, highly recommended as well to enhance comfort and enjoyment. So you want to apply these generally to the region and the penetrating object. Water-based lubricants are ideal for quicker sessions, while silicone or oil lubricants are more for longer term use. And so, again, the breathing techniques are critical while to promote relaxation of the pelvic floor. Reverse Kegels are when the pelvic floor muscles open up, descend a little bit, and that allows for easier penetration. Foreplay also can help promote the relaxation. So you can take time to explore and stimulate around the external genitals and or anus or back hole prior to penetration. So you can try changing positions to see which is the most comfortable for you. Oftentimes, if the partner's on top, they have more control and being in that kind of deep squat position, you're able to relax the pelvic floor muscles a little bit better. So, yeah, again, why relaxation is important. We want to prevent any pain or discomfort. Focus on deep belly breaths or diaphragmatic breaths. Focusing on a longer exhalation to help promote relaxation is recommended. And the stretches that we mentioned before is also helpful. So after intercourse, it's important to prevent injury or infection. So with any intercourse, it's good to urinate afterwards, before and afterwards. You want to monitor your stool if there's any blood, excessive pain or bleeding. Consult with a physician if it's excessive or lasts for longer than a couple days. You want to avoid anal intercourse until your symptoms subside. Take Metamucil, which is a fiber supplement. Drink plenty of water, and you can use a sitz bath, which is a little basin you fill with warm water, and you put it on top of your toilet seat, and that can be soothing to the area. And then, yeah, avoid too much friction. Toilet paper or wet wipes around the area if it's already irritated. Try to use a bidet. Now, in pelvic health physical therapy, you can expect in the first visit for us to do a thorough evaluation, including trying to get your history down so we can best know how to treat you. We'll focus heavily on education so that you are aware and you know more about your body and the tools that we provide for you to be able to be confident in doing your exercises at home. And treatment, which can include what we discussed: the manual therapy, the biofeedback, the electric stimulation. What are some benefits of pelvic health therapy? Improve blood flow and muscle control for erectile function, reduce pain associated with sexual activities, enhance relaxation and reduced anxiety related to pelvic floor function, and long-term improvement in quality of life and sexual satisfaction. So what are the next steps? Well, we have a lot of different clinics. We're expanding a lot with Eisenhower in our pelvic health program. So we have clinics in Rancho Mirage, Palm Springs, and La Quinta. So to see us, a physician referral is required. We do accept most insurances, and we have providers who treat all genders. All right, so now I'm going to open up the floor for questions.
All right. So I know I have a question, but if anyone listening in or wants to ask a question, please feel free to unmute and or put it in the chat. Either way, we'll make sure we get it answered. But one of the things when we were talking about, preparing for anal sex, that kind of thing, I'm constantly bombarded online with ads for pills versus like Metamucil versus douching versus, different things that way. It's like, and it appears, I don't know what your thoughts are on, I don't even know what the name of it is, but one of the brands is completely, it's always promoting their pill form versus others. Do you have a thought on that?
Yeah, there's all sorts of ads on social media.
Right.
I think, you know, in terms of the products, usually with the pills, they're convenient. But if you can get the powdered mix, you're getting a lot more fiber in that scoop than probably the pills. You have to take like a bunch of those pills to get adequate fiber. So I try to recommend powdered forms of fiber when possible. You have to mix it with water and drink it all like quickly because it will solidify and form a gel. So you need to like chug it
Right.
down really quickly, and that ensures you're getting enough water with that. With the pills, sometimes people don't drink enough water either, and then it will still expand. So um, there's like a choking hazard with that, with the
Yeah.
pills. Um, yeah.
So then, in reference to that, then would you use Metamucil, as I think your slide said after, but would you use that kind of as a precursor for to help the fiber?
Oh yeah, definitely.
Yeah.
So,
Yeah.
you would want to use it before and after, ideally like a daily thing where you take the
Yeah.
fiber in 1 to 3 doses throughout the day. And you want to have so the fiber will help bulk the stools and help it come out in one clean package. And you'll have a good bowel movement because if you wipe, there won't be anything
Yeah.
on the toilet paper. So that's like quite clean. So you would want it before and after to ensure, there's nothing left in the rectum. Um, that's ideal for folks who want more confidence with that cleaning. Yes, you could use an enema. Don't want to overdo it. You just want to clean the superficial couple to 3 inches into the cavity. Um, the more if you overuse an enema, you kind of strip some of the mucus in the rectum, and that can lead to more tearing and things like that. So you
Yeah.
want to do the most you can with your diet to, yeah.
Yeah. That's good. It's very good advice. All right. Any other questions from a listener in there? All right, not seeing anything on
No,
that.
really.
Maybe there we go. Please, Andrew.
No, I don't really have anything.
Okay, no, that's
Oh,
all right.
I was gonna say, when you're talking about Metamucil, do you recommend a certain quantity dosage per? How do you?
yeah. It it totally depends on the person, you know. Some people might be getting good enough fiber in their diet and they just need a little bit, like one dose of Metamucil. Some people who don't eat any like fruits and vegetables might need like up to three a day. So you know, it's totally dependent on the person. Again, it takes a while to you want to ramp up your dosage of fiber. You don't want to just,
Mhm.
you know, start with the full dose. You want to start with like maybe half the first week and then build up to whatever you need to get a well-formed stool with good regularity.
Okay. Uh, you talk about exercise. That you say there's that exercise other than Kegels. Can you talk about that, or is that exclusive to going to physical therapy?
No, so uh, we do recommend Kegels generally for like urinary leakage or incontinence or prolapse. Um, and with pelvic pain, though, we usually kind of avoid recommending use of the Kegels because they can lead to more pain. Some people have pain with just contracting those muscles. So we more focus on the down training or reverse Kegels, where we're
Mhm.
trying to get those muscles to lengthen or open up. So, and there are a lot of other like hip, core exercises that we recommend as well.
Okay, thank you.
Hmm.
So, Willie, in a sense of preparation for any kind of thing, if you were thinking of that, is is it better to do it an hour before, 2 hours before? I mean, is it just based on your individual body? How does somebody, I guess you have to learn by it, but what would be a good recommended kind of strategy, I guess?
Yeah, that's a good question. How do you know? Generally, you do want to have like that good, complete bowel movement, 1 or 2 hours before intercourse. Um, and similarly with the enema use, you want to, you know, use a small bulb so that you don't overfill past the rectosigmoid junction, because that's what can trap water. Um, and I'd give it still like 1 or 2 hours prior to intercourse.
Good
Yeah.
idea. Okay. And for someone who has maybe had too much or, over to your point of, I don't know the terminology there, that it's, you have water trapped inside, is there something they take, you just have to wait for the process to work itself out, or do you take something that somebody recommended, you take a pill or whatever, I can't think of which one it is, but, to kind of keep you from having that leakage?
Uh, I know some people take like an Imodium
Yeah.
or loperamide, which slows down the digestive tract so that, you know, you have a little extra time. Um, Usually we don't recommend that unless, you know, to
Yeah.
rely on that, you know, to adjust your transit time. But some people do. And as long as your physician is okay with you doing that sometimes, I don't really see an issue with it.
Okay.
Um, yeah, as long as it's not excessive. And if you do overfill, then s- oftentimes you just have to wait for it to come out.
Yeah.
It's, you know, on its own, or it probably will come out during intercourse, you know, as
Yeah.
the tissues are being stretched and loosening. So,
I mean, it is just the nature of the beast.
It is.
I think people
There's no.
there's a lot of guilt and a lot of shame and a lot of different things that come with that. And we have other lectures, and we'll talk about some of those things when we work with PSLOD and a lot of other events. But there's people realize that any of these activities, every body is different and every process is different, and you just have to kind of understand what yours will be or may be and work around it.
Yeah, I mean, there's a lot of process, and accidents happen. You don't have to put your body at risk, to have a good time. Again, ideally, it's best to do what you can naturally through your diet. All those other things are supplementary.
Yeah. All right. Any other questions? I know we will have additional lectures and other things coming up about diet and nutrition for the holidays and then after, sort of all the things that we'll be ingesting during the holiday time frame, which we tend to do. So, all right. Well, with that in mind, Willie, thank you so much for a very informative presentation. And again, this will be edited and will be sent out to everybody, and then will also be on our YouTube channel for further review in the future, plus on the YouTube channel for the LGBT Center as well. All right. Well, have a very good evening, and we look forward to seeing you on our next presentation. Thanks so much.
Thank you.
Good night.